All right, nursing students, get ready, because today we're doing a deep dive into oxygen therapy.
A big one for all you future nurses out there, for sure.
Yeah, and to help us out, we're looking at a couple of really good sources. One is a nursing management guide, and that's from Unitech Learning.
Very handy.
And the other one, this one's all about how to actually explain this stuff to patients.
Oh, nice.
So, we know those textbooks can be kind of a snooze fest sometimes.
Yeah.
So we're going to cut to the chase and figure out what you really got to know.
Especially for those NCLEX questions.
Oh, yeah, those are coming.
They are.
They are. So, oxygen, we know it's important,
Yeah.
but let's back up a sec.
Yeah.
Why would somebody even need oxygen therapy? Like, what's actually happening in the body?
Okay, so, yeah, we breathe oxygen all the time, right?
Right.
But sometimes our bodies, they need a little extra help. And that's especially true when you're talking about breathing problems, circulation problems.
Oh, okay.
So things like COPD, pneumonia, even heart failure. Yeah, in those cases, just getting enough oxygen into the blood, it can be a real struggle.
I see.
Yeah,
So that's where hypoxemia comes in.
exactly. Hypoxemia, low blood oxygen, and it can cause some serious problems if it's not treated.
Oh, for sure. And I think I remember from pathophysiology, even just a little drop in oxygen can really mess with stuff like wound healing.
Absolutely. It can even make infections more likely.
Makes sense.
Yeah, that's why we have to be so careful about spotting hypoxemia early on.
Okay, so let's switch gears a bit and talk about safety, because that's a big deal with oxygen therapy.
Huge.
And here's a little brain teaser. Oxygen itself, it doesn't actually burn.
No, it's not flammable, you're right, but it makes everything else burn way better.
Oh,
Yeah, so kind of scary.
it's like it's a fire starter.
It's like, think about the fire triangle. Fuel, heat, and oxygen. So if you've got more oxygen around, you're basically just like turning up the volume on how easily something will catch fire. So even a little spark, something that would normally just fizzle out,
Yeah.
boom, big fire if there's a lot of oxygen around.
Oh, wow.
Yeah.
That's why no smoking around oxygen.
Oh, absolutely. Absolutely. Huge risk.
I mean, the sources we're looking at, they really hammer that home.
Yeah, and it's not just smoking, it's anything that could cause a spark, right?
Leaders, yeah.
Space heaters, stoves, anything electrical. Got to keep them far away from oxygen.
And those signs that say oxygen in use, those aren't just for show.
Oh, no.
Everybody needs to know.
Super important. Patients, visitors, other nurses, doctors, everyone. It's about keeping everybody safe.
Okay, let's move on to something a little less fiery. Let's talk about humidification,
Okay.
because I've heard that breathing dry oxygen can be really uncomfortable.
Oh, it can be. Think about it. Your respiratory tract, it's naturally moist.
Right.
And when you breathe in dry oxygen, especially at higher flow rates, it can dry out those delicate mucous membranes in your airways.
Oh, so it's kind of like having a desert wind blowing in your face all the time.
That's a great way to put it.
Ouch.
And all that dryness, it can cause irritation, coughing, make it hard to clear mucus from the lungs,
Oh, right.
which, as you know, can lead to infections.
Yeah, okay, so humidification, it helps by adding moisture back into the oxygen.
Exactly. It helps to keep those airways nice and moist and comfortable, so it's easier for patients to tolerate the oxygen therapy.
But I've also heard that humidifiers themselves can be a little bit risky if they aren't cleaned properly.
Oh, yeah, for sure. That's a really important point. You got to be super careful about that as a nurse.
Because bacteria can grow in there.
Humidifiers can definitely become breeding grounds for bacteria if they're not cleaned right and regularly. And you definitely don't want to introduce those nasty bugs into a patient's airways.
Yeah, no, especially someone who's already kind of vulnerable.
Right, exactly.
That's a good reminder to really stress those cleaning protocols.
Oh, absolutely. Absolutely. Not just for the hospital equipment, but for anything they're using at home, too.
Okay, let's talk about something that every nursing student needs to know, and that is how to recognize hypoxia.
For sure.
So we know it's low blood oxygen, but what are the signs that we should be looking for?
Right.
What should we be watching out for in our patients?
Okay, so hypoxia, it can be tricky.
Yeah.
Especially in the early stages, it's not always as dramatic as you might think. It's not always, someone gasping for air.
Right.
Sometimes the signs, they're really subtle.
Okay.
You got to be paying close attention to pick up on them.
So what are we looking for? Like, what should we be paying attention to?
Well, one of the earliest things you might notice is a change in their mental state.
Oh, interesting.
Yeah, so they might become restless or agitated, or they might seem confused, a little disoriented,
Right.
and that can be easy to miss, especially if you don't know the patient's baseline.
If you don't know how they usually are.
Exactly. That's why communication is so important and good documentation.
Right.
You need to know your patient,
Right.
understand their normal behavior, and then you can be on the lookout for any changes.
Okay.
Right.
And I guess vital signs can give us some clues, too.
Oh, absolutely. The heart rate often goes up.
Oh, okay.
Yeah, the body's trying to compensate for the lack of oxygen.
Makes sense.
Respirations might increase too at first,
Mhm.
but as hypoxia gets worse, you might actually see them breathing slower.
Oh, wow.
That's a really bad sign.
Yeah.
So it's not just about how fast they're breathing, it's the quality of their breathing too.
Right. Are they struggling?
Exactly. You got to be looking for signs of labored breathing. Are they using those accessory muscles? Any sign that they're having a hard time getting air in?
Okay. And then there's cyanosis.
Ah, yes, cyanosis.
A bluish color.
The bluish discoloration of the skin, yeah, and the mucous membranes.
That's a late sign, right?
Yeah, cyanosis, that means the hypoxia is severe.
Mm.
It happens when there's not enough oxygen in the blood, so it starts to look darker, that bluish color.
Okay.
You'll usually see it in the lips first, fingertips, nail beds.
So we've covered how to spot hypoxia. Now, what do we do about it? What can we actually do to help these patients?
So the first thing, obviously, is to give them supplemental oxygen, as ordered by the doctor, of course.
Right.
But it's not just about sticking on a nasal cannula and calling it a day.
Right. There's more to it than that.
You need to understand all the different ways to give oxygen.
Yeah.
Know which device is best for each patient. Make sure the oxygen is flowing at the right rate.
Right. And monitoring them, making sure it's actually working.
Exactly. You've got to be checking their vital signs, their oxygen saturation levels.
Yes.
And documenting everything.
Oh, always documenting. And we can't forget about positioning.
Absolutely. Something as simple as sitting them upright or raising the head of the bed, and that can make a world of difference.
It's like using gravity to help their lungs work better.
Exactly. Now, besides giving them extra oxygen, we also need to think about helping them clear their airways.
Right, because sometimes it's not just about getting oxygen in, it's about getting stuff out.
Exactly. Our sources talk about things like teaching them how to cough effectively, encouraging deep breathing exercises, using incentive spirometry.
Oh, yeah, I remember that from fundamentals.
Yeah, it's all about getting those secretions moving, preventing them from building up.
Right, so they don't get pneumonia or atelectasis.
Exactly. Atelectasis, that's when the little air sacs in the lungs, the alveoli, collapse.
Oh, right.
It's a real problem, especially in patients who aren't moving around much or who have shallow breathing.
And that's where incentive spirometry can be so helpful.
Yeah.
It gives them something to aim for, encourages them to take those nice deep breaths.
Right. It's a fantastic tool for preventing atelectasis.
So we've covered a lot about oxygen therapy in the hospital. But what happens when a patient is ready to go home? What's our role as nurses in that transition?
That's a big one.
Yeah.
Going home with oxygen, it can be a big adjustment for both the patient and their family.
Yeah.
And we, as nurses, we play a really important role in making that transition as smooth as possible.
I bet it all starts with education.
Absolutely. We've got to give them the knowledge and skills they need to manage their oxygen therapy safely and effectively at home.
So that means explaining things clearly, showing them how to use the equipment, answering all their questions.
Exactly. We want them to feel confident,
Right.
comfortable handling the oxygen, adjusting the flow rates if they need to, troubleshooting little problems, knowing when to call for help.
And we need to remind them about safety, too.
Absolutely. Keep the oxygen away from heat, no smoking, and be aware of potential fire hazards in the home.
Yeah. And it's not just about the physical stuff. It's about the emotional side of things, too. I mean, imagine being told you need oxygen to breathe.
Yeah.
That can be really scary.
Absolutely. It can be overwhelming, so we need to be sensitive to that. Let them talk about their fears, offer support, and connect them with resources and support systems that can help them adjust.
Support groups, things like that.
Support groups are great. They can share their experiences, connect with others who get it.
It's amazing how helpful that sense of community can be.
It really is. And don't forget about practical support. Do they need help with groceries? Errands? Are there home health services that can help with bathing or medications?
Wow. So we really have to think about the whole picture.
You got it. It's not just the physical needs, it's the emotional and social aspects too. That's what nursing is all about.
Taking care of the whole person.
Exactly.
Well, we've covered a ton of ground today, from the science behind oxygen therapy to the art of really patient-centered care. I feel like I've learned so much about this seemingly simple intervention. It's actually really complex.
And I hope all you future nurses out there feel ready to provide the best care possible for your patients who are on oxygen therapy.
Remember, it's more than just giving them oxygen. It's about understanding all the little details, anticipating the challenges, and advocating for your patients every step of the way.
And never stop learning. Oxygen therapy is constantly changing. There's always something new coming out.
So stay curious, ask questions, always strive to provide the best possible care. Thanks for joining us on this deep dive into the world of oxygen therapy.
It's been a pleasure. All right, welcome back to our oxygen therapy deep dive, especially for all you nursing students out there.
We're picking up right where we left off, digging into those signs and symptoms of hypoxia.
Yeah.
And our sources are really highlighting how tricky hypoxia can be,
Oh, yeah.
especially those early stages.
It really can be sneaky.
So what are some of the things we should be looking for?
Well, early on, one of the first things you might notice is a change in their mental state.
Oh, okay. Interesting.
Yeah, so they might get kind of restless or agitated, or maybe they seem a little confused, disoriented.
I can see how that could be easy to miss if you don't really know the patient's baseline.
Exactly. You got to know what's normal for them.
Right.
And that's why good communication and documentation are so crucial.
Makes sense.
You really got to know your patient, understand their usual behavior, and then be on the lookout for anything that seems off.
Okay, so mental status changes. What about vital signs? Can those give us some clues too?
Absolutely. You might see their heart rate go up.
Okay.
The body's trying to compensate for that lack of oxygen.
Makes sense.
Their breathing might speed up too, at least at first. But then as the hypoxia gets worse, their breathing rate might actually start to slow down.
Oh, wow. So it can go both ways.
It can. And a slowing respiratory rate, that's a really bad sign.
Okay, something to watch out for.
Definitely.
Yeah.
So it's not just about how fast they're breathing, it's about how they're breathing too.
Right, the effort.
Are they working hard to breathe? Are they using those accessory muscles? Anything that suggests they're really struggling to get air in.
And then, of course, there's cyanosis.
Ah, yes, cyanosis.
That bluish discoloration.
That bluish tint to their skin. Yeah, and mucous membranes.
That's a late sign, right? Like a really late sign.
Yeah, cyanosis is a sign of severe hypoxia. It means there's just not enough oxygen in their blood.
So it starts to look darker.
Right, that bluish color. You usually see it in the lips first, then the fingertips, nail beds.
Okay, so we've talked about how to recognize hypoxia. Now, what can we actually do about it? What are some interventions we can use to help these patients who are struggling to breathe?
Well, the first thing, and this might seem obvious, is to give them supplemental oxygen. But, there's a right way and a wrong way to do that.
Right, it's not as simple as just slapping on a nasal cannula.
Exactly. It's about understanding all the different oxygen delivery systems, knowing which one is best for each patient, making sure the flow rate is correct.
And making sure it's actually working.
Right. You got to monitor their response, check their vitals, their oxygen saturation, document everything.
Always documenting. We can't forget about positioning either, can we?
Absolutely not. Just helping them sit upright or raising the head of the bed, that can make a huge difference.
It's like we're giving gravity a helping hand.
Exactly. Now, besides giving them extra oxygen, we also need to think about helping them clear out their airways.
Right. Sometimes it's not enough to just get oxygen in. You got to get stuff out too.
Exactly. Our sources talk about different techniques for that, like teaching effective coughing, encouraging deep breathing exercises, and using something called an incentive spirometer.
Yeah, incentive spirometry. I remember learning about that in fundamentals.
Yeah, it's all about mobilizing those secretions, preventing them from building up and causing problems.
Right, like pneumonia or atelectasis.
Exactly. Atelectasis, that's when those tiny air sacs in the lungs, the alveoli, they collapse.
Oh, right, I remember that.
It can be a real issue, especially for patients who aren't moving around much or who have shallow breathing.
And incentive spirometry, it kind of gives them a visual goal to work towards.
Yeah,
Encourages them to take those nice deep breaths.
exactly. It's a great tool for preventing atelectasis and promoting good lung function.
So we've covered a lot about managing oxygen therapy in the hospital. But what happens when a patient is ready to go home? What role do we play as nurses in that transition?
That transition to home oxygen therapy, it can be tough for the patient and their family.
I bet.
And we, as nurses, we have a really important job in making that transition as smooth as possible.
I imagine education is a big part of that.
Absolutely. We need to give them the knowledge and skills to handle their oxygen therapy safely and effectively at home.
So that means explaining everything clearly, demonstrating how to use the equipment, answering all their questions, no matter how small they might seem.
Exactly. We want them to feel confident and comfortable managing their oxygen.
Right, so they know what to do if there's a problem, when to call for help.
Right. And we also need to remind them about all the safety precautions.
Keeping the oxygen away from heat, no smoking, all that.
Absolutely. And being aware of potential fire hazards in their home. It's not just about the physical stuff either.
Right, there's the emotional side of things, too. Imagine being told you need oxygen to breathe.
It can be a really scary, overwhelming experience.
Definitely.
So we need to be sensitive to that. Let them talk about their fears, offer support, and connect them with resources and support systems that can help them adjust.
Like support groups.
Exactly. Support groups can be so helpful. They can share their experiences, connect with others who understand what they're going through.
That sense of community can make a big difference.
It really can. And don't forget about practical support. Do they need help with groceries, errands, things like that? Are there home health services available to help with things like bathing or medication management?
Wow, so we really need to think about the whole picture.
Absolutely. It's not just about the physical needs, it's the emotional and social aspects too. That's what makes nursing so special.
It's about taking care of the whole person.
Ex-
Welcome back to our deep dive. We're wrapping up with the final part of our look at oxygen therapy.
It's been quite a journey. We've covered a lot of ground, from spotting those sneaky signs of hypoxia to really empowering those patients to manage their oxygen therapy once they're back home.
And speaking of home oxygen, I was hoping we could dive into some of the practical things to think about when a patient is transitioning out of the hospital.
Absolutely. One of the first things that pops into my mind is making sure that home environment is safe and ready for oxygen therapy.
I bet you're thinking fire hazards again.
Always got to be thinking safety. It's really important to assess for things like smoking in the home, making sure the oxygen's kept far away from any heat sources, even checking those electrical outlets aren't overloaded. It's all about minimizing risks.
And I'd imagine accessibility is a big thing too, making sure that the equipment is easy to reach and easy to move around, especially for patients who might have trouble getting around.
You're spot on. It's about thinking like a nurse, anticipating those patient needs. We want to make sure they can move around their home safely and comfortably with their oxygen setup.
Now, oxygen equipment, it can be pretty bulky. Are there different types of systems that might work better for home use?
You bet. There are a few different options, and choosing the right one really depends on the individual patient, their needs, and their lifestyle. For some folks, a stationary concentrator might be the best way to go.
How do those work?
They actually pull oxygen from the air, so you don't have to worry about those big, heavy tanks.
Oh, that sounds way more convenient, especially for someone who's active around the house.
Right. And then for patients who are more mobile, maybe they like to get out and about, there are portable oxygen concentrators or smaller oxygen tanks.
Yeah.
Those give them the freedom to go places, do the things they enjoy, maintain their independence.
It's incredible how technology can really help improve a patient's quality of life.
It really is. And while we're talking quality of life, it's important to remember the psychological side of living with oxygen therapy. It can be tough.
I bet. Having to rely on supplemental oxygen, it can't be easy.
Some folks might feel self-conscious about the equipment. Some might worry about being a burden on their family,
Yeah.
or even have anxiety about their health in general.
So how can we, as nurses, help patients work through those feelings?
It starts with just listening, really listening, and empathy. Let them talk about their fears, validate their feelings, reassure them that it's okay to feel this way.
That therapeutic communication, right?
Exactly. We talk about it all the time in nursing school, but it's so important.
It is.
And then we need to connect them with support systems. Support groups can be amazing.
Oh, yeah.
They provide a safe space to share their experiences, connect with others who really understand what they're going through.
That sense of community can make a huge difference.
Huge. And don't forget about practical support, too. Do they need help with errands, groceries, anything like that? Are there any home health services available, maybe to help with things like bathing or managing their medications?
It's really about considering all aspects of their care.
Exactly. Not just the physical needs, but the emotional and social aspects as well. That's what truly holistic nursing care is all about.
Taking care of the whole person.
You got it. Well, I think we've covered just about everything we can on oxygen therapy today, from the science to the art of patient-centered care. I feel like even I've learned something new.
Me too. And for all you future nurses out there, I hope you're feeling prepared and ready to provide amazing care for your patients who rely on oxygen therapy. Remember, it's so much more than just giving them oxygen.
It really is.
It's about understanding all the ins and outs, anticipating those bumps in the road, and advocating for your patients every step of the way.
Couldn't have said it better myself. And never stop learning. This field is always changing. There are new technologies and approaches popping up all the time. So stay curious, ask lots of questions, and always strive to provide the best possible care for your patients.
Well said. Thanks for joining us on this deep dive into the world of oxygen therapy.
It's been a pleasure.